Hello, everyone. So great to have you here tonight. We'll give it another minute or two as people continue to roll in. It's wonderful to see many of familiar names and patients here. So thank you so much for joining in. This is wonderful. We'll give it another minute or so to get going. It's a good thing to do on a potentially rainy night tonight. So I'm glad you joined in. Okay, well, I think we'll go ahead and get started as others continue to come in. Good evening to both of you, to all of you. Thank you so much for coming out tonight, at least virtually, to have this discussion on glaucoma and what else can I do. As I've been thinking about ways we could learn together, many times patients, in fact, many of you who are joining in tonight, will ask the question, well, what else can I do? As you think about different ways you can maybe adjust your lifestyle or things to add or things to adjust so that maybe you can help minimize the risk of glaucoma development or progression. So I thought, what a great question that many of you have asked. Let's try to make a little lecture out of it and have a little discussion that can relate to that topic. So with that background, what else can I do? I mean, as a patient, as I asked that, I'm Austin Lifferth. I'm one of the optometrists here at Center for Sight. I get to work alongside Dr. Befrus, our comprehensive ophthalmologist, and Dr. Amit Brar, our consultative optometrist, as well as we have a great resident, Dr. Hamda Shah, who will be completing his residency in a few months. And then also joining us tonight is our new future resident, Leah Griffin. So we're excited to have her on the webinar tonight as well. Looking forward to have her part of the practice and joining us in a few months as well. So we have a really great team, great to work with each one of them. And one of the things I really enjoy about the setting that we're in is that we all really feel that each patient matters. So hopefully you feel that tonight as we kind of learn together. And to that point, we feel like education is an important part of the process as we work together. So this is an exciting time as we celebrate World Glaucoma Week. So we felt like maybe there's something we could do at Center for Sight to commemorate and to celebrate, increase awareness for world glaucoma. I really like their goal to unite for a glaucoma-free world. I think at some point that'd be wonderful if we can not only prevent blindness from glaucoma, but to get it to the point where it's diagnosed earlier and patients don't even know that they have glaucoma as far as affecting their vision. And you're on the map. So of all the World Glaucoma Week activities, here we are in Carmel, Indiana. So thank you for being a part of this and making this an opportunity where we could represent this area for World Glaucoma Week. And so I appreciate joining in tonight as we talk about different lifestyle choices that things we do that may affect our glaucoma diagnosis and our glaucoma prognosis. I'm hoping that as we lead to the discussion tonight, you'll have lots of questions. And then at the end of the lecture, we can go over those questions and hopefully leave feeling like we've all learned something and better understand glaucoma. Here's kind of a brief overview. A few questions. What does glaucoma look like? What causes glaucoma? What can I do? Meaning as a patient, what else can I do? As a patient may ask. And then after all these questions, I'd like to hear from questions you have. So as I try to answer these first four, I'm sure you'll have other questions. Let's hopefully get to that point where we can answer any other questions you have. And feel free to text it in the group chat if you'd like to do that. That way, while you're thinking about it, it'll be on there and we can go over it at the end. That way we can answer it while you're thinking about it and not forget it. So for the first question, what does glaucoma look like? And when people ask what is glaucoma, I think my simplest answer that makes the most sense to me is it's nerve damage. Specifically, it's nerve damage to the optic nerve. And as far as I'm thinking about it, the optic nerve is the only nerve that we can look at in the body in real time. And the optic nerve should look like a donut with a round shape and a small depression and a nice even rim. However, in glaucoma, gradually that rim gets a little bit thinner because we lose the tiny nerve fibers that make up the larger nerve. And as it develops, we might have spots of bleeding, or the rim actually gets thinner. Interesting, as providers, we know what glaucoma looks like, and it has characteristic structural loss. I mean, usually inferior rim or superior rim is where we're likely to see it. So as providers, we look in those areas particularly. So this is a patient, their right eye. This is a patient, their left eye. And you can see how in the left eye, that rim is much thinner down here inferiorly and superiorly than the right eye. And even more, there's some area bleeding here in the right eye, some areas of bleeding there and there. This is what your doctor might say is, we call it a disc hemorrhage. A hemorrhage, an area of bleeding along the disc margin. Sometimes it's called a Durant's hemorrhage. And there's some thought that if we see a disc hemorrhage, that could suggest that maybe the glaucoma is more unstable, it's not as controlled as we'd like, and we may have to do some things to try to minimize further progression. But glaucoma is just simply a nerve damage specific to the optic nerve, and it has characteristic nerve fibrillary layer loss that causes nerve or neuroretinal rim thinning. So if the provider can look in those areas, we're more likely to pick up glaucoma. Not only does it have characteristic nerve fibrillary loss and rim thinning, that rim gets thinner and thinner, but also has associated changes on testing. So this is what we call OCT, optical coherence tomography. And many of us have seen this as well as you come in for the exam. We feel like this test here really helps us understand this test over here. So we see what the clinical exam looks like. This test here can help give us another perspective, maybe quantify how much loss there might be. And interestingly, in the right eye here, this is the right eye here, matches this with this one. It says some of the thinning might be up here superiorly. The left eye says there's thinning inferior and superior, and that matches with what we see over here. So as providers, we look for structure correlation. We try to see, does this computer estimate look like what we see clinically? And if so, it increases our certainty that these spots here are true defects. The OCT is really helpful, but it's just a computer. And it gives us kind of a statistical diagnosis. They're trying to see, well, for this patient, for each of you who are unique, what are the odds that your optic nerve would have this level of thickness? And if it's outside the normal range, 1 to 5% or less than that, then it'll show up as yellows or reds. Things that doesn't seem like it's statistically significant that you're likely to have that level of neurofibrillary thickness. So it's something we should watch for. So your doctor may say might be some thinning in different parts of the optic nerve, which usually correlates with rim thinning. So we have these two structural tests, and I found it's so important to put these tests always in the context of our clinical exam. What does the nerve look like? The next test that we commonly do, and I know many of you love this test so much, is our visual field test. And this is a visual field of the right eye. So if we start to see optic nerve damage down here, if the rim gets thin enough down here, we'd start to see changes up here. For this patient, their right eye is normal up there. This might just be some variation, some variability in the visual field testing. The left eye, if we start to see thinning down here or up there, as shown in the OCT, we'd expect to see correlating visual field damage. So here's the left eye blind spot, and this area here correlates with this superior thinning there and there. So it's helpful it's ideal when the structure function tests all seem to correlate. So this is what glaucoma is. It's just nerve damage. It has characteristic loss that we can correlate with structural testing like an OCT, a computer estimate, and then we can do a visual field test to see what is the function of it. This is the only way where we can see how well the optic nerve is working. We know what it might look like, but how well may it be working? And many times as you do this visual field test, it's such a hard test to do. Anytime you do it, it makes you feel like you failed it because it retests certain areas of different level of brightness. Having said that, it does give us as providers and you as patients good information to see how much it might be affecting your vision and where it's located. Many times it prints off this black and white sheet as we've shown you before. And these are areas where the patient may not have seen it as well as we would like. However, it's not necessarily a black spot in the patient's vision. And that can be concerning sometimes for patients where they think, well, they see a dark spot, that means I can't see anything at all in this area here. And many times patients just say that it seems like it's maybe a little blurry, or I think a patient today called it fuzzy spot. I mean, they can still see around it. They just may not be as clear in that area. And honestly, in these areas here, this is towards the patient's nose, good vision over here in the right eye might overlap this vision over here in the left eye, and they may not even be aware of it. So a patient still may have early glaucoma and still have great vision, good functional vision. We just want to keep it that way. We want to do what we can as providers and with you as patients to try to keep it so we don't have further structural loss that could lead to more functional loss, so these spots don't get bigger where they can be more noticeable. So glaucoma is nerve damage, and it can cause, if there's enough of it, damage to parts of our side vision that usually appears more as missing pieces or blurred spots. We see them on a visual field as actual dark spots. And as providers, we look at these spots and we try to see, are these spots getting bigger, like extending outward, or are they getting more dark or deeper, suggesting maybe that area is progressing. For patients, at least every year with glaucoma, they should have their visual field checked. For patients with different levels of glaucoma, like more moderate or advanced, maybe it's twice a year. Or if it's central, we might do a central visual field test. So depending on the reliability, the stage of the disease, they may have to do more visual fields. And although it's really an uncomfortable, boring experience, it really gives us good information. So we appreciate you in advance and thank you in advance when you do your visual field testing for us as well. So that's what glaucoma looks like. That might be the easier question to answer. The next question is, what causes glaucoma? This might be more of a challenging question to answer. So we know that it has a structural loss. It's preferential characteristic damage. This is an example of inferior rim thinning with a neurofibular defect. This should show up with a visual field up here in the superior nasal area. But there's three main thoughts of what causes glaucoma. One is it could just be eye pressure related. And that's what a lot of times we focus on, meaning that if the patient's eye pressure is abnormal for them, then it could be causing glaucoma. And abnormal could be pressures above 21, which is commonly what we refer to as high tension glaucoma or high pressure glaucoma. Or it could be pressures in the normal range between 12 and 21 that we're finding during the clinic hours. And that's what we call normal pressure glaucoma or normal tension glaucoma. In either case, whatever the pressure range, whatever the pressure may be, it still may be abnormal for that patient. And thus it's causing pressure on these nerve fibers, causing glaucoma mechanical damage. But we know there's more than that. And this makes sense because sometimes patients can have normal eye pressures. They're on treatment, they've had different surgeries, but sometimes their glaucoma still may progress. So what else could there be that could be causing this glaucoma progression? Another thought is maybe there's vascular damage. So maybe there's some circulation issues. For whatever reason, the optic nerve may not be getting the blood supply like it needs. Or if it is getting the blood supply that it needs, maybe they're just episodic, or maybe there's just episodes of times when it's not getting the blood supply. And over time, that can certainly cause damage to the optic nerve, even if there's pressures are in the normal range. The other cause, so imagine this kind of this three sector process there, or possible causes, is biochemical, meaning maybe there's some sort of inflammatory process as well. And imagine like an inflamed nerve on your elbow or your wrist may not work as well, or might feel sore when you move. Well, similar, if there's inflammation in the optic nerve on a small scale, maybe over time, it just may not work as well and loses some of that function. So a patient with glaucoma may have one or all these components affecting the optic nerve, the health and the status of it. We try to find out which ones they could be, and as providers treat and minimize, adjust as much as we can. Having said that, the main modifiable risk factor, the main thing that we can do as providers and things we can do as patients, as we'll learn later on, is really adjusting the eye pressure. So that's what causes glaucoma. We try to think of those three things while focusing a lot on the eye pressure. Related to that, the next question is, what can I do? What can I as a patient do if I've been diagnosed with glaucoma, or if I'm at risk for glaucoma? And a lot of it has to do with eye pressure. So every time when we see you, we check your eye pressure, we use that little probe, we put the numbing eye drop in your eye. As we look through our microscope, this is what we see. We see these two rings. And ideally, we try to bring these rings together so they're just barely touching. That tells us the eye pressure reading. And this is important because the eye pressure reading is really an end result of a lot of different factors. It might depend on how much fluid is being produced in the eye, how much fluid is being drained out of the eye through the natural drain pathway, even episcleral venous pressure. So perhaps if you're holding your breath or bearing down, that raises the pressure that can provide some resistance to the outflow. But all these factors that influence eye pressure come up as this one number that we give you. And this one number is at one moment in time of what the eye pressures are when these two rings come together. So that's why sometimes when patients find that their pressures are fluctuating, one day they're 14 at a certain time of day, next day they're 15 or 17. We know they can fluctuate depending on a lot of different factors. So we just take pressure readings at different times and different days over the course of the care and try to find the trend and adjust if we need to. So the best thing that we can do as patients, if you have glaucoma or at risk for it, is to monitor the eye pressure. And we know from some really good studies that the eye pressure, or IOP, intraocular pressure, it's a main risk factor for the development of glaucoma and the progression of it. And actually each pressure point matters. So sometimes your doctor may say that, well, your pressures are 16, we should probably get them down to 14 or 13. That might just be a few points difference, but from many studies we've found, just a few points can make a big difference on slowing down that progression. We also know about eye pressure is that with eye pressure, the more fluctuation there is, the more risk of progression. And the best way to treat glaucoma is to lower the eye pressure. One of the ways they're doing that is by using eye drops. There's been some really good studies that shown over and over again that if there's poor adherence with our eye drops, if that's what you're taking, then that increases the risk of visual field progression. In fact, they found that if you take your eye drops every day as prescribed and you're at your target pressure range, that range that we think that's less likely to progress, there's a very low chance of it progressing. So certainly one thing we can do is what you're doing already. Having that awareness and taking your eye drops every day as prescribed. It's hard to take medicine for a condition we can't feel. However, if you can find a routine, that helps prevent further progression. And routines preserve vision. So if you can kind of remember those simple things of eye pressure, and we check the pressure like this, we're trying to make sure we have good stable range, low enough so it's less likely to progress. So to answer that question, what can I do? Well, keep taking your drops. That's the first step. If you're on topical therapy, to do that, some of you may have had surgery. You may not be on eye drops. That's wonderful. If that's the case, you still keep your appointments so we can keep doing testing to make sure the pressures are still low enough. We'll know if a patient's pressure is low enough if the tests are less likely to progress, if they're not progressing. However, if we start to find on our different testing that there's reliable correlating progression, that tells us that the pressures may be too high. And as we learned over here, each point matters. We try to lower the pressures even further. So we talked about what is glaucoma, what does it look like, what can I do? The next question, which brings us all together today, is what else can I do? As a patient, if I'm doing everything right, I'm taking the eye drops and keep my appointments, is there anything else I can do as a patient to help prevent progression, maybe control the disease a little bit more? And I thought if you could imagine the spectrum, one end of the spectrum are non-modifiable risk factors or lifestyle things we can do. The other end is modifiable. And if you think about that, some examples of non-modifiable things we can't change, maybe our ethnicity, our corneal thickness, that's the front part of the eye that we use to check the eye pressure. That can be a factor in development, glaucoma development or progression. It's just the way your eyes may be, and age. Those are things we really can't modify. On the other hand, like as we discussed, we can certainly modify the intraocular pressure. And many times for most of patients, that's all we need to do. However, as I mentioned, sometimes some patients can still progress, unfortunately, even with good, stable eye pressures and good adherence or compliance with the medications. So I think there's a zone in here where maybe it's semi-modifiable. And as I've thought about that, some of that has to begin with some things we can do, lifestyle changes, and factors we can change that might help modify our disease and our progression. One of them is health literacy, or another word is just understanding more about glaucoma. And that's exactly what you're doing tonight. So coming here tonight virtually to learn about glaucoma, that's one of the first steps to helping modify the disease. The more we know, the more we can understand, and we can understand the purpose of the drops and the treatments and the different testing. So great job, you're already taking that first step. Other things that we can modify is our body mass index, meaning our overall weight, disease mitigation, or meaning if we can control our blood pressure and diabetes, maybe sleep apnea, our lifestyle, trying to limit stress, stop smoking, cut back on smoking, and nutrition. Really what we eat can make a difference on how our body feels and how our eyes feel. So I wanted to just focus on this area here, kind of expand upon that a little bit more of what else can I do, what else can we do if we have glaucoma to minimize the risk of progression. And we came up with this handout. Over the last several months, I've been collecting references. And we'll get this printed off. I'm going to update the handout with a few other references. So when you come into the office, we'd be happy to give you your own handout. On the front will be a quick summary. On the back are all the references if you're interested in that. But let's take a look at this main slide and kind of talk about these 5 factors. So when we talk about what else can I do, I'm going to zoom in. It might be a little blurry, but hopefully be a little bit larger and more magnified. I thought of, if we can think of 5 S's, things that we could stop, 5 S's we could stop, and then things that correlate with that are things we could start. So I know some it's a little bit of a stretch, but one of the first S's is sugar and systolic. So sugar meaning watching our diabetes, our blood glucose levels, our sugar levels, watching what we eat, maybe less processed foods. And for systolic, that relates to blood pressure. And interesting, for glaucoma, it can be affected by too high a blood pressure or too low a blood pressure. So making sure that our blood pressure ranges are in the normal range. Sometimes, and many times, your doctors are doing such a great job treating your blood pressure, if that's applicable, and it's almost too good of a job, such that your blood pressure may be too low. As a result, there's less circulation to the optic nerve. So a common question that I like to ask is, if you're on blood pressure pills, do you take them at nighttime? If so, I'd recommend working with your doctor to see if you can take them in the morning. When we're sleeping, our blood pressure gets lower as it is. And if we take a blood pressure pill, that may get even lower. So if a patient says that when they wake up and they sit up, they're feeling kind of dizzy or lightheaded, that could be a sign that their blood pressure is too low. And we'd want to work with their doctor to make sure it doesn't stay low like that, affecting circulation. For example, if, let's say the normal blood pressure range is 120/80, if that bottom number, the 80, gets below 60, we're finding that seems to be a cutoff on when that circulation is really affecting the optic nerve and the overall health. So if you're concerned about that, there are some blood pressure monitors you can get, not too expensive, or to monitor that. That's a good way to check it. Kind of like patients with diabetes monitor the sugar levels. Also, this patient with blood pressure can monitor that. So hopefully monitoring those 2 factors, this is more like a disease mitigation or trying to control blood sugar or diabetes. That's the way we can increase circulation. I'll come back to that in a minute. So the corollary to that is starting to eat healthy. Try to eat less processed foods, eat lots of colorful foods, fruits and vegetables, nuts, grains. Probiotics are helpful. We're finding there's some links between our overall gut health, interestingly, and glaucoma. And some of that can be related to this low-grade neuroinflammation that's developing from some gut dysbiosis. When the gut is imbalanced, the gut health is imbalanced, there's less diversity, That can increase inflammation in the gut, which actually transfers to different parts of the body as well. So a lot of systemic conditions have been related to gut health. And to fix it, try to eat healthy, less processed foods, taking a probiotic, supplements are all helpful as well. Really, a lot of times when asked about diet, if it's good for the body, it's good for the eyes, as my staff probably hears me say too often. But that's a good thing to consider for that as far as helping with our nutrition and being aware of our lifestyle. The next one, as we go over here, is smoking and stimulants. And by this, I mean cigarette smoking, of course, marijuana use. Stimulants might be alcohol and coffee. With smoking especially, that's really detrimental for the body and for the eyes, just because it affects the blood flow, makes the blood vessels smaller. So if we're concerned about a condition that depends on good circulation, well, smoking can make the blood vessels smaller and limit that circulation. I've heard that quitting smoking is one of the hardest things you could ever do. But if you're in that situation, I want to let you know you can do it, to stop smoking. And if you can cut back a little bit, anything's better than nothing, but it's going to be a great benefit for the body and for your eyes. And there's some evidence regarding stimulants as far as coffee. Maybe a cup or two a day isn't too bad for a patient. However, from some genetic risk studies, they did find that if a patient is at high risk for developing glaucoma and they drink coffee, it can be a factor for them, raise their eye pressure a few more points. So just being mindful of doing all things in moderation in that area, but also if you can, stop smoking. That's going to be the best way to help increase circulation. With that, many times it's hard to smoke if you're around friends and family who are smoking. So try to start new circles of friends, start new habits, perhaps join new clubs that encourage health and wellness, being active, start with moderation with caffeine. These are things that we can do that we can control the amount of circulation and things that could affect the eye pressure. The third S is stress. And this may be easier said than done, but trying to manage our stress the best we can helps decrease the intraocular pressure. It also increases circulation. When there's stress, a couple things that happen. One is it causes increased cortisol levels in our body, and that can increase our eye pressure. The other problem that causes or develops from chronic stress is if we're always in a fight or flight mode, it increases our blood pressure. And blood pressure then will constrict the blood vessels. High blood pressure will constrict the blood vessels, and then that limits circulation to the optic nerve. Now, it's easier said than done, but trying to manage stress is a good way to help a lifestyle change that can help mitigate or minimize the disease progression. So there's some new studies that have come out that are really effective on mindfulness and meditation. One that just came out is in the Journal of Glaucoma, and they're talking about the 365 breathing technique. So basically what they're saying is for 3 times a day, do 6 cycles of in and out breathing for about 5 minutes. So for 3 times a day, do 6 cycles of in and out breathing for 5 minutes, meaning you're breathing in through your nose, hold it for a few seconds, 5 seconds ideally, and then exhale. And they've found that by patients who practice, as they compared their 2 groups, people who did this 365 breathing versus those who didn't, they found that those who did do this practice breathing 3 times a day, I think it was over 8 weeks. I'll have to check the study results, but they had decreased eye pressure by a couple points, 1 or 2 points. And if each point matters, that can make a big difference on disease progression. It was enough of a difference, almost 2 points, I believe it was, that's almost like adding another eye drop. So if you think about it that way, the alternative to lowering the eye pressure is to add another eye drop in addition to what you're doing. Or if you can help practice mindfulness and limit stress, 365 breathing, for example, that might be enough to help control the eye pressure in addition to taking your current eye drops. So it's interesting studies what they're finding about mindfulness. The problem with another challenge with glaucoma, unfortunately, is we're dealing with a condition that we know can affect and damage our vision if it's not stable. And unfortunately, settings like that, that can cause stress on its own, causes increased stress, increased anxiety or depression. So it's hard to say, let's limit the stress when we're dealing with a condition that can be very stressful. But having mindfulness and the breathing technique can certainly help adjust that so it's more in control. And I've found this myself, that if I'm starting to get more stressed or worried about something, to take time to breathe, and you'll find your heart rate decreases. There's this term, heart rate variability, HRV, and these patients who did the 365 breathing had lower HRV, heart rate variability, because overall is more stable. So trying to minimize stress is something we can do. It doesn't cost anything, and it's a good way to help minimize the disease progression, partly, probably, by lowering the eye pressure and increasing circulation. So related to this, and I think something that can help with stress, is a sedentary lifestyle. So another S to avoid is to avoid sitting regularly, watching TV, reading, work on the computer. Try to find in your schedule little bits of time where you can just move more. So maybe it's so the daytime, taking your dog for a walk, or at lunchtime, taking a quick walk around the block. Maybe it's when you drive to work, park a little extra further away, so you have to walk a little bit further. Taking the stairs, if it's just a floor or two. Find some ways to keep moving. And moving, exercising, increases circulation. It affects our body mass index, our overall weight, our weight structure, our BMI. It can certainly affect our sugar levels, our hypertension. It increases circulation. We make new friends. It decreases stress. So just the idea of start moving. And all of these things I'm talking so far, it's a lot to deal with. But if you look at each one of them and consider maybe just finding one thing out of each of these green boxes that you could do, and to make it a little thing, and then try that for a few days or a few weeks, and then add a little bit more. And many times doing things like this, you'll find that it's not good for the eyes, but it's good for the body too. Well, the final S of these 5 S's is sleep apnea. So this is something that we're learning more about. This is when a patient is sleeping, because of their sleep position and perhaps their body mass index, their BMI, combination factors, they stop breathing. And then it's just for a few seconds sometimes. Other times it's prolonged. And when it's prolonged like that, if they stop breathing, well, the next step would be we wouldn't get the oxygen that we need. And that affects different parts of the body, but to the nerve, which is so sensitive, if we don't have the oxygen that we need, that affects the circulation to the nerve as well. As a result, that can cause glaucoma to progress. So we can have patients with good eye pressures, improved eye pressures with treatment, but if they find that they're not getting the oxygen supply they need, several mini micro episodes of poor circulation throughout the nighttime, that can cause damage to the nerve itself. So for those patients who might be at risk, and there's some ways you can find out about this if you're at risk for it. One is if you know that you snore, or someone's told you they snore. When you wake up, are you tired? Do you have daytime sleepiness? If you have a higher BMI, more body structure can make a difference for that. If you have a larger neck width, and if you're a male patient rather than a female patient, you might be a little more risk for sleep apnea. So if you find you're snoring a lot, or someone's told you to snore, or if they've told you to stop breathing, these are things you can do. Talk to your primary care doctor, or talk to us. We could order a sleep study, and we could start restorative sleep. The benefit would be then you have a system where you can have continuous positive flow to your body. And I actually found out another day from a patient that they can actually implant something that helps control the breathing pathway, so you continue to get oxygen. So it may not be just with a CPAP machine, but there's some other advances for a patient that may be helpful. So starting this restorative sleep can make a difference as well in how we feel the next day if we want to start moving. It might affect our caffeine intake. It might affect our stress. If we're tired and fatigued, it's easy to be more stressed. So it's interesting how all these things are related, and they can be connected in the things that we're trying to do. So having said that, I think the next step to consider is I try to summarize all these factors, these 5 S's to stop, these other ones to start. I guess in other words, I would say our goal on what else can we do is to decrease inflammation. So is there something that could be causing inflammation in your life? Maybe it's stress or your diet, lots of processed foods. Maybe it's different smoking habits, sleep apnea, or increased circulation. So two things we're trying to do as far as lifestyle, broad terms, we want to decrease inflammation that could be developing in the body, and we want to try to increase circulation. Those two things, I think, can be big factors as far as controlling glaucoma development and progression. And there's been a lot of good studies. It's been hard to have some good studies related to these topics, but several are coming out where we're starting to have more strong evidence-based, certainly consensus-based, that these are different areas that we can do for patients and as providers to help treat glaucoma. So we talked about what glaucoma is. We talked about what does it look like, what causes it. We talked about what things we can do. For sure, take your eye drops, keep your appointments, do your testing. And then this is kind of a summary of what else can we do. Things we could consider with the end goal of trying to decrease inflammation and increase circulation. So I tried to answer those questions. Now, I'd love to answer maybe some of your questions. If you can, maybe send it through the chat feature. That might be easier for patients who might not have the best microphone system or can't hear it as well. That way we can kind of answer it through chat. But I really appreciate each of you coming out tonight and learning about glaucoma. It's fun as we learn together for that. Many times as providers, we try to take time to describe the test results, the purpose of the treatment, but we don't have settings like this too often where we can just talk about it and try to answer questions in a more informal setting and elaborate on different topics. There have been some times where well, not many times, but there have been some times where a patient will ask, after I've maybe seen them for a year or longer, they've been on eye drops and done the different testing, they may ask, well, doc, why do I have to take these eye drops? And it's embarrassing. I hate to admit that, but maybe along the line, I didn't answer that question well enough of why the points of taking the eye drops or why the points of doing the testing. So that's important to try to recognize, and that's why we feel these are important. Great questions. Thank you for coming in. One question is, does normal aging make it worse? That's a great question. Age can be a risk factor for glaucoma. So as we get older, that's more likely to develop. And for two reasons. One is age can affect our trabecular meshwork or the outflow. So as a result, the eye pressures get a little bit higher, which means we want to watch it carefully. Glaucoma is a chronic, progressive, unstable condition. So if we have higher eye pressures that could develop as we get older, that could make it worse. That's for the eye pressure side. And then the optic nerve side, like those pictures I showed you, we might have higher blood pressure or poorer circulation. We also know that our cerebral spinal fluid pressure, the pressure inside our brain, might decrease, and that can maybe cause less back support for the optic nerve and cause it to get worse too. That goes into deeper detail that probably want to hear tonight, but there's a chance that it could get worse. We know that that's the case, and that's why we watch these conditions carefully as an age-related condition. Yeah, great question. Next question is, do you think it's better to be more aggressive versus less aggressive in treating glaucoma, or does it just depend on the patient? Another great question. It depends on the patient. So I think generally speaking, I would say it depends on the age and the stage. So what's the age of the patient? What's the stage of glaucoma? So if the patient is really young and they have early to moderate glaucoma, and they're going to live another 30 or 40 years, in my mind, I feel like we have to be really aggressive and try to get those pressures as low as we can, get to the target pressure range sooner, so there's less likely risk of progression. I mentioned earlier, I want to make sure we get to the point where patients don't even know that they have glaucoma, that it's so well controlled, it never affects their side vision, and that they can have a good vision throughout their life as long as they need it. However, if a patient has early glaucoma and they're more advanced stage, and maybe their health isn't as good, we may not have to be as aggressive. We can just keep the pressures low and such to the point where it's less likely to progress. If there is a good thing about glaucoma, usually it progresses slowly. So we have some time to do some different tests to adjust some treatments to make sure that it still stays stable. So I think to answer your question, it depends on the age and the stage. Age of the patient, the stage of the glaucoma. Another question is, I know I need to increase my blood pressure. This patient is talking about how their blood pressure is 80 over 50. You know, if a primary care doctor saw that, they say, this is great. Your blood pressure is really good. Keep taking the blood pressure medicine. However, we're learning that there's a circulation issue too when it gets that low like that. And especially if you feel dizzy when you get up or sit up, that could be a factor. You might also find that you might have colder fingers, or there's a delayed capillary reflex test. If you squeeze your fingers and it takes a while for it to get red again, maybe you have less blood pressure there. So if that's happening in the fingers, we know it's happening in the optic nerve. Yeah, so there's ways you can increase your blood pressure. Maybe don't take your blood pressure pill at nighttime. Talk to your family doctor. Maybe they need to cut back on the blood pressure. Tell them you're feeling dizzy. And then I usually don't tell this to patients, but maybe have a little more salt in your diet, or take a saltine cracker at nighttime just to kind of monitor that. But I think it's great that you're monitoring your blood pressure. It's hard to treat something if we don't know what it is. So I think it's great to monitor for that, and they may help with how you feel overall as well. Blood pressure is kind of like imagine a U shape. We don't want it too high, we don't want it too low. So we want it right there in the middle. It's right there in the middle, and that's where it's the best for the body and the eyes. And what about leaning over? Is that more pressure in the eye? Great question. I mentioned too, I showed you that picture of those two rings coming together for when we check your eye pressure. And that ring coming together is dependent on so many different factors, and the eye pressure can fluctuate. So things that can cause it to fluctuate is maybe holding our breath, like we're doing strong weightlifting, heavy weightlifting, or sneezing can do it. Leaning over, like head down positions, like when you're working out, yoga, have a dog down position like that, downward dog position. Those are things that can make the pressures higher. So if you have glaucoma, you can still work out. Maybe just make sure you breathe regularly when you do your workout, and try to limit your downward dog position or head down position for that. That can make the pressure higher. You know, the eye is amazing, the body is amazing, and most of the time it's very resilient. So a little bit of higher eye pressure temporarily isn't going to cause a problem. I don't want you to worry about that. Our concern is if we have it a lot or for a long period of time, maybe over time it can. And so trying to find moderation in different activities is good to do. Great question. Why are drops so expensive? Oh, I don't know. I asked that question myself. I know there's a lot of research that goes into it. We have the pharmaceutical answer that they give us. There are a lot of generics that are available for a lot of the name brand medications. However, sometimes these generic medications don't work as well. They're not as predictable as a name brand medication. So as a result, we might not have the same eye pressure control. And remember, each point of eye pressure matters. So the doctor may not be as comfortable keeping on generic as long. But if drops get so expensive and it's hard and insurance doesn't cover it, we totally understand. We don't ever want you to pay for anything that's too expensive. Talk to Dr. Befrus or Dr. Brar or myself. There's other really good ways we can treat glaucoma without using eye drops, from in-office laser procedures to some glaucoma procedures that Dr. Befrus can do. These are covered by insurance, they're built to your insurance. And many times it works well enough where we can get you off one of your eye drop, or maybe both of them, or all of them. So you still have good eye pressure control. You just don't have to depend on eye drops. So we want it to be a condition that doesn't affect your lifestyle and is such a big burden for you. I think in my mind, the right treatment for the patient is the one that's sustainable and tolerable. But if it's going to be too expensive every month, that's not really sustainable. And if it's not comfortable, causes dryness and redness, that's not really tolerable. It can be very effective. If it's not sustainable or tolerable, then we might not get the results we're looking for. So there's other good options for that. Great question. Can you treat spinal fluid pressure? Yeah, so I can give you a long answer to that. When we lived in Florida, I was fascinated by the sinkholes down there. And sinkholes happen because we have the surface up here, and then down below at some point there was water. Well, that water has gone away, And then as a result, there's no back pressure holding up the sand and the soil. So gradually the soil just kind of caves inward. Now, I thought about that. That's kind of like our cerebral spinal fluid pressure. If we have low cerebral spinal fluid pressure, which happens as we get older, more in the elderly, and as we get older, we don't really have that back pressure to keep the nerve from bowing backward to help support it. So that can facilitate, it's more common to have glaucoma damage in patients with low cerebral spinal fluid pressure. And I thought about that. I don't know if there's a way that you can safely increase cerebral spinal fluid pressure. Next time we have a neurologist as one of our patients, I'm going to ask them that. Is there a way we can safely do that? We know that there's conditions where it causes increased pressure, but I don't know if there's a way we can safely do that. So I've been thinking about that too. I'll have to get back to you on that one. Let's keep in touch on that one there. But it doesn't have that support system. So it's a great point on that, that maybe glaucoma isn't just eye pressure, but it has to do with perfusion or circulation pressure. It may have to do with spinal fluid pressure. So all these factors are playing a role in the optic nerve appearance. Next question is hard exercise like cutting grass okay, safe? Yes, that's great. Actually, gardening, mowing, those are all good ones to do. Make sure you wear your safety glasses, of course, if you're doing some weed eating. But those are all good things to do. And the neat thing about gardening and working in the yard is you've exercised a lot before you even know it. You're doing up and down, moving around. You might bending over a little bit, but that's okay. Just kind of limit your head down position to increase circulation. But I think that's great. Staying active is a great way to help to help control our blood pressure, our blood sugar, minimize the stress. I like all these questions. I like how you're thinking. That just doing those little things like that can help the body and the eyes. Can you heal a damaged nerve once it's been damaged, regain lost nerve function? That's a great question. I had a patient today, and they talked about a situation they know where there's some head trauma, and from the head trauma, the patient lost a lot of the side of their, I believe the right side of their body. And that's all nerve damage. Glaucoma is nerve damage. Now, this patient has been able to regain some function. They've been able to walk a little bit better. Or maybe like a patient who has a stroke, they might be able to speak a little bit better. Or they're able to walk a little bit better. That's the nerve damage in the brain, and the brain damage affecting those nerves. Right now, we can't regenerate the nerves yet, but there's a lot of research in that. So if we can have nerve repair, nerve regeneration, think of all the many areas that would help in the eye and in the body from paralysis patients to glaucoma. And there's a lot of nerve regeneration studies done in mouse models right now that are showing a lot of great promise. So I'm going to say no right now, but in the future it's to come. So there's a lot of big research in that, a lot of emphasis in trying to help regain nerve function. So until then, what we try to do is prevent further nerve fiber loss, further nerve fiber damage. We want to prevent any further nerve damage there, and then hopefully in the future we'll be able to regenerate it to help it come back. Yeah, great question. How can one determine poor circulation or inflammation are primary causes? I like how you're keeping it going there and the different summaries. So we talked about the three causes of glaucoma. One can be eye pressure, but the other one could be circulation. The other one could be inflammation. And I think my recommendation is just try to look at those different 5 S's I talked about, see if there's something you can do for those areas, and that might affect how you feel. If there's inflammation, we can always do some blood work to check for inflammation like that. If there's circulation, like I said, that might be more of a situation of when you're waking up if you're feeling dizzy. But try that nerve capillary refill test where you just squeeze on your finger and see how well it reperfuses. That could be a factor that maybe the blood pressure may not be working as well. And sometimes some patients just have what we call vascular dysregulation. I mean, the regulatory factors that go into blood vessels, they don't work as well, or they work too well. So when they constrict, maybe they constrict too much. When they dilate, they don't dilate fast enough. And all those factors can affect the circulation, be a sign of it. If you're someone who has to wear a sweater in a room when everyone else is fine, that could suggest maybe there's poor circulation. If your hands themselves are always cold, that could suggest maybe poor circulation to the extremities and maybe even to the optic nerve as well. So those are two factors. I love that question. I may have to do another part 2 of this lecture on how we can determine if there's poor circulation or inflammation. So hopefully that kind of gives you a better idea and answer from that. Next question, recommendations for surgery versus regimen of drops. And that depends on the age and stage. So I'll go back to my first answer, age and stage, and also those 3 things I look for. For a drop to be the right drop, it has to be effective, has to be tolerable, has to be sustainable. So in any of those scenarios aren't met, then we need to consider surgery. There have been a lot of patients where their eye pressures are working great. It's keeping the pressures low enough, the condition's stable, the tests aren't progressing, but they can't afford them, or their eyes are really dry, they're having a lot of irritation. Those would be good surgery candidates. Or in other scenarios, the drops they're taking aren't working. They're not keeping the pressures low enough. They're not getting that target pressure range. As a result, those would be good surgery candidates. So I'd consider age and stage, and then those 3 factors. Is it sustainable? Is it tolerable? Is it effective? And maybe put together those 2 components in the context of the patient can give us a better answer. And that's one thing I find interesting about glaucoma. It's a challenging condition. There's a science to it, but also there's an art to it. And each patient is different. Each of you are unique. And our goal is, each patient matters. Our goal is to find out, well, what can we do for you to keep it so your eye pressures are low, the disease doesn't progress, and then we keep the vision stable. Yep. So hopefully that helps for you. And then another question. These are great questions. You're doing great. Keep them coming. Briefly, just define glaucoma. Glaucoma, I tell patients, it's simply nerve damage. So if you imagine if you had nerve damage to your finger, if it's just mild nerve damage, it might affect the sensation. If it's significant nerve damage, it might affect the function. You might not be able to move it like it should. Well, glaucoma is nerve damage, but specifically to the optic nerve. And a little bit of damage might affect the vision some. A lot of it can cause more blurry vision. And a lot of patients start to notice their vision here towards the nose, getting dimmer or darker or blurry spots. The problem with glaucoma is we can't feel it. Many times it doesn't hurt. So we try to do different tests, structural tests and functional tests, to try to find what's causing to try to determine the level of glaucoma and if it's progressing. So I think the short answer for you is glaucoma is nerve damage. It's nerve damage to the optic nerve. And it's caused by a lot of different things, those 3 things I talked about in general. Yep, so good. Yeah, check in with your family care doctor. I think to answer the question earlier, how can you tell if it's inflammation or circulation? Talk to your family doctor about how you're feeling. If you're feeling dizzy or weak or fatigued, or if you wake up and through the daytime you're tired, maybe it's a sleep apnea component. So those are good factors. I think glaucoma is an interprofessional disease, meaning we're here to discuss it for your eyes, but honestly, it's something we need to maybe involve a pulmonologist for sleep study, maybe a holistic doctor for gut health and gut dysbiosis, maybe a primary care doctor for diabetes and blood pressure control. So it's definitely a condition that's more than just eye pressure. And as we involve others, we get better care. Is heavy lifting safe or harmful? No, lifting is fine. You can certainly do lifting or cardio. My concern would be is if you're holding your breath a lot. So if you're holding your breath a lot, that can maybe cause kind of like sleep apnea-like conditions, many micro episodes of poor circulation. Furthermore, it can also make the eye pressures higher. So making sure you breathe regularly is fine to do. And that's where it's still good to do cardio exercises. That increases circulation. So it's safe to do for sure. Great questions here. I had glaucoma for years, which has been controlled with medication. How quickly can the medication stop working and or the condition worsen? Some medications work longer than other medications. So medication you might have to take 2 times a day. That's because they only work for about 10 to 12 hours. Medications you take at nighttime are good because they work for about 24 hours. If you stop taking them completely, they might have a little bit of a carryover effect, but usually after a few days to a week or 2 at the latest, especially for some of them, it's pretty much washed out of the system in my mind. So That's why it's still good to take your drops every day. If you're gone on vacation, you miss a dose or two, just pick up where you left off. You might forget a night dose. That's okay. Get it the next night. So fortunately, the drops do help level out those eye pressure fluctuations, but they don't last forever. So that's why it might be nice to consider things like SLT laser or surgery, things that might lower it even better, especially if you're having a hard time remembering to take your eye drops, for example. And fortunately, glaucoma is a condition that usually, most of the time, ideally, progresses slowly. So if you just miss a dose or two, you're less likely to have progression, but it's those multiple doses that can cause a problem. And as a slide I showed you earlier, that we found from several good studies, if a patient takes their eye drops every day, they're less likely to progress if their pressures are at their target pressure range. So routines certainly preserve vision. If you're having trouble taking your eye drops, let your doctors know. There's other good things we do for you. Combo drop versus single treatment. How long do you wait to switch or implement one versus the other? Or does it depend on compliance, target eye pressure, and stage? Yeah, so there's different classes of medications. And with these different classes, these different types of medications work by lowering the eye pressure in different ways. Some types of drops just decrease aqueous production or the fluid production. Some types of the drops help with outflow, so they help lower the eye pressure that way. Sometimes the drops work in both conditions. So depending on the type of glaucoma that's causing it, we might just do a single treatment, or if we want to get the pressures really low and we need multiple ways to target it, we might do combination drops where we put 2 drops into one, or we compound them with a pharmacy and put 3 drops into one. So there's different ways we can do it. Again, we're trying to find whatever treatment is sustainable, effective, sustainable, and tolerable. So it kind of depends on the compliance. That's a great point, and the target eye pressure range. We do know from studies that the more drops we prescribe a patient, the less compliant they likely are to be. So if I give you 1 drop, it's hard enough to put a drop in and remember to do a drop for a condition that's asymptomatic. But if I give you 2 drops, I know that we're risking the chance of less adherence. 3 drops, that really reduces the risk of compliance there. So we try to make it as simple as possible, something that's sustainable. And the finger test, I was just trying to describe, it's what's called the capillary refill test. So if you just push on your finger, let's see, there we go. And right now it's red, but if I push on it, it gets white for just a second and then it refills with red. So kind of looking at that and seeing how your perfusion is. If it's delayed and it stays white, maybe there's some circulation issues. Another thing you can do is if you go outside or if you're in a cold setting, if your fingers, instead of being red, are white at the end, you may have some vascular dysregulation where the blood vessels are constricting, the blood's not getting to the area, and that's causing some micro ischemic or poor circulation events. So check for white fingers with a refill squeezing the finger test, or in cold settings. Those could be both signs of poor circulation. And what is involved with this surgery? The main goal of surgery is to increase outflow. So imagine a sink filled with water. Well, we can adjust the water in the sink by turning down the faucet. That's one way. That's why we many times use eye drops. Those drops do a good job. Or the other way is we can make the sink, the pipe, work better. And sometimes that involves removing the drain cover in the sink, or sometimes it involves dilating the pipe so it's bigger, so more fluid comes out. And that's basically what surgery does. It has different ways we can increase the outflow by maybe bypassing the common drain pathway, maybe dilating the larger drains within the eye. Sometimes we just bypass that drain completely through a surgery called trabeculectomy. But the main purpose of the surgery most of the time is to improve outflow, decrease that resistance that could cause higher eye pressure. And many times this surgery can be, to answer the next question, can be combined with cataract surgery. Yeah. There used to be a time when that's the only time we could do these glaucoma surgeries, is when it's combined with cataract surgery. However, now we can do them as standalone procedures. So even if you've had cataract surgery in the past, or you do have cataracts, but you don't need cataract surgery, Dr. Beffers does a great job we can still do standalone procedures, is what they're called, still covered by insurance. And if we can get you off your eye drops for a year or two and then do another surgery down the road, that's a great benefit. Your eyes are healthier, they won't be as dry, you don't have to worry about taking drops every day. So the nice thing is we have a lot of great ways we can treat glaucoma nowadays that we just didn't have in the past. And many times we can do it with just one eye drop or no drops at all. I'm beginning to think that glaucoma might be more of a medical disease more of a surgical disease more than a medical disease, meaning we might not have to use eye drops, as many eye drops for as many patients as we used to do in the past, because now there's some really great surgery options. Another question is, does sleep in position affect the eye pressure? We do know that the down position, so let's say if I sleep on my left side, then that eye pressure might be a few points higher than the other side. So that can make a difference for you. Maybe if you have a sleep apnea, you don't have it treated, that can affect the circulation. So imagine a high pressure and poor circulation that can cause glaucoma to progress. So the sleeping position can do that as well. And when you're in the supine position, laid backward, that can cause higher eye pressure. So maybe sleep with an extra pillow. That might be helpful so it's not as high. Laying backwards causes the episcleral venous pressure to increase, hard for the eye pressure to decrease, and that's like some backflow resistance. So maybe sleep with an extra pillow, trying to favor one side or the other, and that might help with the balance. And contact lenses really don't add much pressure, much noticeable to the eye pressure. In fact, they are using contact lenses in the future. They have some out right now where they can help measure the eye pressure continuously. So there's some neat things coming out down the road for some continuous eye pressure monitoring. And then a couple more questions. You guys have been great. What a great great group we have here. I really appreciate your questions. Is rubbing eyes hard when they itch bad for eye pressure? So there's some really great studies that talk about sneezing can raise your eye pressure, coughing, rubbing it can do it. So if you rub it too hard for too long, it can make the pressures higher. A necktie could do it. Wearing swimming goggles, tight swimming goggles, can make our pressures higher. There's all these things, but as I mentioned earlier, the eye and the body is really resilient. Many times, most of the time, it can compensate, the blood vessels adjust, and it doesn't cause any problems. However, if it's something that happens a lot for a long period of time, prolonged periods, pressures are higher, that certainly can cause some glaucoma damage. There's a lot that can affect glaucoma, but there's a lot that we can do about it. And a lot of times just thinking about how to do things in moderation and do things to increase circulation, decrease inflammation from the things we eat, the things we do, so forth. And related to that, questions are supplements. Supplements are helpful. There's some supplements like ginkgo biloba that helps increase circulation, may even help with visual field performance, helps decrease eye pressure. So ginkgo has been shown to report it. There's some medicines like niacin, B12. Niacin is an antioxidant, and that helps that biochemical neuroinflammatory component. So taking supplements like that may be helpful. A lot of times, and I'll tell my patients, it's just whatever's good for the body is good for the eyes. So I think certainly eating healthy, we get our best nutrients by having a nutritious diet. If not, if you can't do that, then certainly supplements are helpful. And this is where it's kind of hard to give us good evidence base, because it's hard to have evidence-based medicine for different supplements because they affect people in different ways, and it's hard to have the right proportions. But in general, it makes sense. So I think it's worthwhile to consider something like that is helpful for the body. Do cataracts add to eye pressure? They could add to eye pressure indirectly in patients in what we call narrow angle glaucoma. So the lens in the eye, cataract is when the lens in the eye gets cloudy. And when the lens gets cloudy, it gets a little bit bigger. As a result, it pushes on the iris from behind. The iris might close off the angle. Here's your cornea, here's your iris, and that angle is where the fluid drains. And if that angle gets narrower, that fluid might not drain out as well. So as a result, a patient might start their diagnosis with open angle glaucoma, but if cataracts progress and get bigger, that angle might get narrower and they might have a narrow angle glaucoma component, in which case cataracts could possibly make the pressure higher. Having said that, many times doing cataract surgery opens up the angle. So we have a lot of times patients who have cataract surgery, and just doing cataract surgery alone, for some might open the angle enough, the pressures get lower. So there's some neat things they can do for that, and then combine it with the surgery to help the drain work better. Are eye exercises beneficial, like eye rolls? I don't think it hurt. I'm not sure if there's a study about that. I think squeezing the eyes too hard might make the pressure higher. I did read an interesting article today about reading, and they looked at the eye pressures of patients who read a text, like a book, versus smartphone use. And they found that those patients who did smartphone use or tablet usually held a little bit closer, and those patients had a little bit higher eye pressure, 2 points higher than those who were reading with text. And their thought was maybe there's more, it's closer, so there's more convergence, as we call it, more prolonged strain, and making the pressures a little bit higher compared to those who are a little bit further out, less stress. That posture is more natural compared to an iPhone, for example, that posture is down. So they thought there might be some different factors related to that. So even as far as reading might affect it, but I'm not sure if it necessarily hurt the eye, but I don't think it necessarily helped the eye either, but I don't think it's a bad idea. Yeah. And the final one for tonight, do migraines increase eye pressure? This might be another answer. This maybe indirectly could be related to it. We do know of patients who have migraines, many times might have some vascular dysregulation. They might have colder hands, for example. They might be a little more cold intolerant. They get colder easier in a normal room setting. Migraines are a vascular condition. So if there's poor vascular supply circulation, that might trigger a migraine for whatever reason. And that poor circulation also translates to poor circulation to the optic nerve. So we do have patients who have, one of the features of a patient who has normal tension glaucoma, patients with glaucoma with pressure in the normal range, many times these normal tension or normal pressure glaucoma patients also are commonly, or they commonly may have migraines. Migraines don't cause the glaucoma, but they're usually associated with that. There are also patients who are usually thinner, more slender, colder hands, cold intolerant, maybe a delayed capillary reflex test, cold fingers, or in cold settings like that. So they may not necessarily cause high eye pressure, but they sure can be related to some settings like that. So this is great. You guys have been wonderful. Thank you so much for coming in tonight. And hopefully this gives us a better idea of what causes glaucoma, what it's like, what we look for, and what else can we do. For sure, keep doing what you're doing. Taking your eye drops, keep your appointments, doing the right tests. At the same time, do things in your world that might decrease inflammation by what we eat, what we do, and increase circulation by staying more active, start moving, being mindful, having taken some time. Remember the 365 breathing technique. 3 times a day, do 6 cycles of breathing for about 5 minutes. But hopefully this gives us a better idea for glaucoma. Please give us a call if you have any other questions. And when you come in for your appointment, I'm going to try to get this handout updated. So there's some more things that I found most recently that you can have when you come in for that. But thank you for joining. We sure care about you, we care about your condition. We try to work together as a team, and each patient matters here at Stanford Site. So if you have any other questions, let us know. Thank you for joining tonight. Appreciate it.